Is home care or a nursing home the right choice for your aging parent? This is one of the most difficult and emotional decisions a family can face. You want what's best for them, but navigating the options can feel overwhelming. You're not alone in this journey. We're here to walk through it with you, offering clarity and support so you can make a choice that brings peace of mind to everyone. Let's start by understanding the core difference. Home care is exactly what it sounds like. Professional support brought directly into your loved one's home. This can range from a few hours a week of help with errands and housekeeping to 24/7 medical assistance. The biggest advantage: familiarity. Your parent gets to stay in their own cherished environment, surrounded by their memories, their belongings, their community. This sense of independence and comfort is priceless. It can significantly boost their emotional well-being and help them maintain a sense of self. Think about it. Waking up in your own bed, having coffee in your favorite mug, looking out at the garden you've tended for years. These simple routines are anchors in our lives. Home care preserves that. Financially, home care can be more flexible. You pay for the specific services you need, whether that's companion care, personal care like help with bathing and dressing, or skilled nursing care for medical needs. If your parent only needs part-time assistance, it can be much more cost-effective than a nursing home. We spoke with Sarah, whose mother, Mary, has been receiving home care for 2 years. Sarah told us, "Mom didn't want to leave her house. It's where she and Dad built their life. Having a caregiver come in for a few hours each day to help with meals and make sure she takes her medication has been a game changer. She's happy, she's safe, and I have peace of mind knowing someone is checking in on her." Mary herself added, "My caregiver, Lisa, feels like a friend. We chat, we watch our favorite shows. I don't feel like a burden. I feel supported." Now let's talk about nursing homes, also known as skilled nursing facilities. These are residential facilities that provide round-the-clock medical care and supervision. This is often the necessary choice for individuals with complex chronic health conditions that require constant monitoring and specialized medical equipment that isn't feasible at home. The primary benefit of a nursing home is the immediate access to a full team of healthcare professionals, doctors, nurses, therapists, all under one roof. If a medical emergency occurs, help is literally just down the hall. This level of comprehensive 24/7 care can be a lifesaver and a source of immense relief for families who are worried about their loved one's fragile health. Nursing homes also offer a built-in social structure. Residents can participate in organized activities, share meals together, and form new friendships. For a senior who has become isolated at home, this social environment can combat loneliness and depression. We talked to John, a retired professor who has lived in a nursing facility for the past year. He shared, "At first, I was resistant, but my mobility is very limited, and I was getting lonely after my wife passed. Here, I've joined a book club, I play chess every afternoon, and the nurses are wonderful. I feel safe and engaged. My kids can visit me without worrying about my medical care. They can just be my kids again." This structured environment provides a routine and a community that can be incredibly beneficial for both physical and mental health. So how do you decide? The decision hinges on 3 key factors: the level of care needed, your loved one's personality and preferences, and your family's financial and logistical situation. First, let's do a needs assessment. Be honest and realistic. Does your parent primarily need help with daily tasks like cooking, cleaning, and transportation? Or do they have significant medical needs like wound care, IV therapy, or dementia that requires constant supervision? For non-medical or intermittent medical needs, home care is often a perfect fit. But for intensive 24/7 medical supervision, a nursing home is likely the safer and more appropriate option. You can consult with their doctor or a geriatric care manager to get a professional evaluation of their care requirements. Second, consider your loved one's personality. Are they a homebody who treasures their independence and privacy above all else? If so, the transition to a nursing home could be very difficult for them. The familiarity and comfort of home care would likely be a better match. Or are they social butterflies who are feeling isolated and would thrive in a community setting with daily activities and new people to meet? In that case, the social benefits of a nursing home might outweigh the comfort of their own home. It's crucial to have an open, compassionate conversation with your parent about their wishes, if they are able to participate. This is their life, and their voice is the most important one in this decision. Finally, look at the finances and family dynamics. Both options can be expensive. Investigate what Medicare, Medicaid, or long-term care insurance will cover. Home care costs are based on hours of service, so the price can vary widely. Nursing homes typically have a fixed, all-inclusive monthly rate, which can be very high. Do a thorough cost comparison for your specific area. Also, consider the impact on the family. Can family members realistically fill in the gaps in care, or is everyone's plate already full? Being a primary caregiver is an incredibly demanding role, and it's essential to avoid burnout. Sometimes choosing a nursing home isn't about giving up. It's about ensuring your loved one gets professional care while allowing you to preserve your relationship as a son, daughter, or spouse, rather than becoming an exhausted full-time nurse. Let's hear from Dr. Ramirez, a geriatric specialist with over 20 years of experience. She advises, there's no one-size-fits-all answer. The best choice is the one that prioritizes the senior's safety, health, and happiness. I always tell families to tour facilities, interview home care agencies, and talk to other families who have been in their shoes. Gather as much information as you can, and remember, the situation can change. What works today might not work in 6 months. Be prepared to be flexible and reevaluate the plan as your loved one's needs evolve. This decision is a journey, not a destination. It's a process filled with love, concern, and a deep desire to do what's right. Whether you choose the personalized comfort of home care or the comprehensive support of a nursing home, you are making a choice based on love. The goal is to create a safe, supportive, and dignified environment for your family member in their later years. You are their advocate, their champion, and their family. We hope this has provided some clarity and comfort as you navigate this important decision. Making an informed choice is the best thing you can do for your loved one and for yourself. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more supportive content for families. And if you have an experience you'd like to share, please leave a comment below. Your story might be just what another family needs to hear today. Take care, and we'll see you in the next video.